Hello and good morning, everyone. Welcome to the first installment of the Process Automation webinar series presented by Formfast. My name is Philip Blanks, and I will be your host this morning. First off, I want to thank everyone for joining us this morning. If you're busy like most of us are, I know that your time is pretty valuable, but the good news is that these monthly webinars will last no more than 30 minutes, so we better get you in and out and also leave you with some insight on how to improve your business processes to help your facility to function more effectively. So before we jump into the presentation, I want to make sure that you all are aware that the audio for the presentation is being broadcasted right now through your computer speakers. So if you are experiencing any difficulties with your audio, send a quick chat to the host, which is myself, and we can get you access to join the teleconference. Once you're connected to the teleconference, make sure your computer speakers are muted, otherwise you'll get some terrible feedback. And also questions. We will have a Q&A session at the end of the presentation. All these slides, but we'll have a presentation at the end of the presentation, so go ahead and submit your questions at any time in the chat panel, which is located to the right of your screen. So without further ado, I'd like to introduce our awesome presenter today, Solution Architect Ryan Brown, who will show us how we can automate purchasing requests and capital expense requests. So welcome, Ryan.
Thanks, Philip. Good morning, everyone. Before we get started, I just wanted to thank you all for taking the time to listen in today. All right. So basically what we want to talk to you guys about today is FastFlow and our purchase request and capital expense request workflows. So FastFlow is a web-based tool that allows you to capture data and use it to automate workflows and also generate dashboards and reports. Electronic forms are routed instantly anywhere in the hospital, which allows you to maintain an audit trail and generate notifications to ensure quick completion of tasks. FastFlow allows you to monitor these critical metrics and key performance indicators in real time. So before we get started with walking through the process of completing a purchase request, I want to first show you the blank purchase request form that I am working with today. Our purchase request workflow is just one example that we'll cover in our monthly FastFlow webinars. So our goal today is to explain to you how we can convert your existing paper workflows into an electronic format that allows for automatic routing, data validation, tracking, and reporting. We design each one of our FastFlow forms in our form design software, and FastFlow supports the use of fillable text fields, checkboxes, and also drop-down lists. FastFlow can also use pre-populated data, so we can look up data from a database, and also perform data calculation such as multiplication and additions to sum up totals for our purchase request. In today's demonstration, I'm going to perform a database lookup to automatically pre-populate some of the information on this workflow. So for example, the vendor information, the vendor phone number, ID number, and also the initiator, so myself and my department number and date will automatically be populated onto this workflow. Now, as a staff member in your hospital, every staff has their own permissions, which allows you to restrict the workflows that they're able to view and access within FastFlow. For example, all employees may be able to access the human resources evaluation workflow, but you may be able to restrict the purchase request workflow to certain departments and also managers. Users are also able to search for a particular workflow or use the category drop-down list to view workflows that are assigned to their account. We do support integration into your hospital's Active Directory system, so your staff can continue to log into FastFlow using their existing username and password that they use for other hospital systems. FastFlow can also query an internal or third-party database to perform a data lookup and populate part of the workflow. So for example, we could perform a lookup by either vendor ID or vendor name. All vendors that meet any of my search criteria will be returned and I can click on select to select a vendor. So in this example, I selected and searched on a vendor ID with the number 1 on it. So any vendors that met the criteria of having a number 1 in their payer ID column would be returned. And to select a vendor, all I would need to do is click on select. The search criteria and data columns can be customized to store any information that you want to use to populate the workflow. So for example, we can easily add in additional columns as well to support the vendor's address, their website, their sales rep, or any other information that identifies the vendor that you would like to automatically be populated onto the workflow. In addition, we could also point the FastFlow workflow to one of your existing third-party databases. So rather than using a local Formfast database, if you have a database out there that already has all of your vendor information to it, we could point the workflow towards that existing database so you do not have to worry about keeping two databases in sync. After I have selected Alliance Medical as my vendor, the user is able to fill out the remaining sections of the workflow. In this example, we have automatically inserted the vendor information from our lookup, in addition to the employee name, their department number, and also the date based on the account logged into into FastFlow. We are also inserting a unique requisition number in the upper right-hand corner here, which allows you to easily identify and locate the workflow in your content management system. FastFlow supports the use of fillable text fields, drop-down lists, and also checkboxes. And you may also specify required fields in a FastFlow workflow as well, which is something that you cannot do currently on paper. So for example, we could set any of these categories and fields to be required to ensure that the user fills out the information before they submit the workflow for approval. In this particular workflow, we are also automatically calculating the price by multiplying the quantity and price unit fields. This is important because we are routing this particular form to the appropriate parties based on the total dollar amount. For example, if my total in this workflow is over $10,000, my vice president will receive the workflow after my manager approves it. However, if the workflow is over $25,000, the CFO will also receive it. And if it is over $50,000, the CEO will also receive it. And all of these routes and rules are configurable by you, so you could set them up to match your existing hospital procedures and policies. Now, FastFlow also has an internal messaging system to keep track of requests and also send additional information over to individuals. In my example today, I have an electronic message that I sent over to Joe Miller, my department manager, to explain the purchase request that I just created. You'll also notice that we track the location of messages and these requests. With a request done on paper, you may put your request in an inter-office envelope and wait for your document to be delivered somewhere in the hospital. It may get delivered to the wrong floor or sit on a manager's desk when they're away on vacation. Within FastFlow, you're able to see where the present location of the workflow is at all times. I could tell if the workflow is sitting on my manager's virtual desk and also for how long using the activity column in the far right. My manager will also receive an email notification alerting them of a new pending request. So it doesn't matter where they are in the world. They could be on vacation, they could be traveling. As long as they have access to your hospital's VPN network to be able to access FastFlow, they are able to log in, view your purchase request, and also approve it. Now, FastFlow can be configured to send out email notifications to users. So depending on how often you use FastFlow, if you're a daily user that's logging in all the time, you may want to turn off the email notifications. That is configurable by the user. But if you're someone that rarely logs into FastFlow, you may want to receive that email alert just to let you know that you have a new pending request. So after receiving the email notification of a new request in FastFlow, my manager is able to log into the system to review my request. As the workflow moves through the route, each person is able to view the completed form, add in additional information to the workflow. So for example, if I forgot to fill out a particular section, I could click on that field and add in additional information, and then choose to approve or reject the workflow. My manager is also able to view the required actions on the bottom right under Workflow Actions. So in this particular case, they need to approve and sign the workflow per the requirements that I have set up in the workflow route. If they choose to reject the workflow, FastFlow allows them to enter a reason to notify the initiator on why their workflow was rejected. If they click on Sign and Send, their digital approval will be inserted with the signature box, and the workflow will automatically be routed to the next person for approval or completion. The logic that you define in FastFlow allows for FastFlow to automatically route your workflow to all required parties. And this is important because there's no longer any need to remember who needs to approve a particular workflow if a particular dollar amount is set. So for example, with this particular workflow, we require a signature from our vice president if it's at $10,000, our CFO if it's $25,000, and our CEO if it's $50,000. Rather than remembering and keeping track of everything, especially if you're a user that's only putting in, a purchase request, every couple months, FastFlow takes care of all of that logic and automatically sends the workflow to the next person. So in this particular workflow, since it was over $10,000, we required both my manager, Joe Miller, and our vice president, Victor Pernelli, to sign off on this particular workflow. Once they approve and sign the workflow, Joe and Victor's signature will automatically be inserted into the workflow. We also automatically insert the date and timestamp of when the approval was captured next to their name. And since this workflow was less than $25,000, we do not require the CFO or CEO signature, and the workflow is now complete. So these routes and rules that I'm showing here for the $10,000, $25,000, and $50,000, they are fully configurable, and they are all designed in our Visual Workflow Designer tool, which is what I'm going to show you next on how you could set up these routing rules. So the Visual Workflow Designer is an easy-to-use web-based tool to design your FastFlow routes. In today's example, we routed the workflow from the initiator to my manager, Joe Miller, and then finally to our vice president as the total amount was over $10,000. For each route, you could define the logic based on any of the fields in your workflow. And here's an example of linking the vice president step to the total value field being greater than $10,000. I also built out the same logic for the CFO and CEO at $25,000 and $50,000. So that you could see on the right-hand box in the role step where a total is greater than $10,000 and then the checkbox above it that says link this step to a form field, that's how I am setting up the linking to make sure that the workflow gets routed to the vice president if the total value is above $10,000. If the total is less than $10,000, it would not get routed to Victor in this particular case. Now, the steps on the left-hand column allow you to determine who receives the workflow next. So we could route the workflow based on roles, such as their IT director, CFO, CEO, as well as routing by departments. We could also prompt the user on who they want to route the specific workflow to, or also automatically route the workflow based on a particular data value or checkbox in the workflow. So for example, on the workflow that I showed you guys with the checkboxes for warranty and service agreement, we could set up a route that if the contract or warranty box is checked, that the workflow automatically gets routed to a legal review team or a contract management team as well. Each step also allows us to specify if a signature is required. So we have two options for capturing an electronic signature. We could require a simple sign and send, where the user just needs to click on sign and send, and the workflow will get routed to the next party. Or we also allow the use of entering a PIN with the electronic signature. Now, the PIN just adds an extra layer of security, so if a person walks away from their desk, leaves their computer unlocked and the workflow logged in, rather than having someone walk up to their desk and hitting sign and send, adding the PIN feature will allow them to, enter a numeric PIN just to verify that it is them logged into the system. Our workflows also allow the use of adding external file attachments. So, for example, on the left-hand side, you can see the checkbox that says any user can add unlimited attachments. So a good use of this would be attaching a PDF printout, for example, of warranty terms. And we also allow the use of providing virtual Post-it notes to remind the user of important information. So we could prompt and alert the user of any particular information that you want to point out that may not be part of the form surface. So you could think of it as, if you have a paper form and you stick a Post-it note on it, the Post-it note's not part of the original form surface, but it alerts the user of some additional information. We also have the ability to add step actions during each approval process or at the final disposition. So in my example above, I have actions occurring for the CEO, the contract review team, and also in the final disposition phase. For our CEO, we have email notifications configured to automatically send out to him if the total amount is over $50,000. We also require their signature with a PIN for extra security. For the contract review group, we have the entire group receiving an email notification. We are also archiving the completed workflow into the contract review group so that they can view all completed purchase requests in the future. And in the final disposition phase, we are returning the completed workflow to the initiator, writing all of the data to a SQL database, and also exporting the completed workflow as a TIFF image for our content management system to import. And that's what these little icons are here, located on each step. So we have, under the CEO, we have the pen icon with the red dots to indicate a pen, with the email icon as well. For the contract review group, we have the email icon with the little person in the hand to indicate archiving to their group. And under final dispositions, we have the arrow to return to sender. We have the database icon to indicate that we're writing the data to the database, and also the TIFF image file to indicate that we are exporting it as a TIFF image for content management. So there are a lot of different actions that may be performed, and we find that writing it to the database is a favorite, as it allows our customers to view dashboards and reports inside of FastFlow. Since all of this data is being stored in a SQL database, you may also use third-party tools such as Crystal Reports, Excel, Microsoft SQL Studio tools, etc., to view your completed workflow data. Now, within FastFlow, we do have some dashboards and reporting that's built into the application itself. So the dashboard applications allow your staff to very easily view the data that they want to see to make informed decisions. Each workflow can have its own dashboard so that you can choose what information is important for you to view. In this particular purchase request example, I am displaying the workflow name, the description, how old the workflow is from when it was started, along with the progress and current location. So we're able to see at a very high-level view of where each workflow is and when it was last changed. Under the progress step, we're also able to see how far along in the progress, whether or not it's at step 1 or step 6, as it moves through the workflow to get approvals. Now, FastFlow also allows for reporting in many different formats to display data collected from your workflows. We could display the data in both charts and also tables. All of your custom reports may also be saved as jobs and scheduled to run automatically. For example, you could build a job to check for expiring contracts in the next 45 days, and then you can configure that job to run every day at midnight and automatically send out email results to show you and alert you of what contracts are expiring in the next 45 days. And there's a lot of value with the data that you're collecting with your workflows. So it's very important that we feel that you move the data that you're collecting on paper into an electronic format so that you would have all the data into a SQL database and be able to run reporting and track information on that particular data that you are collecting. I hope that you enjoyed today's webinar. Thank you for taking the time to listen in. I want to turn the presentation back over to Philip now to answer any questions that you may have.
Perfect. Thanks, Ryan. We had several questions come in, actually, but if you haven't done so already, go ahead and enter your questions in the chat panel on the right of your screen, and we'll go ahead and get them answered. But I'll start with the questions that we do have, Ryan. The first question was, does Formfast offer a content management add-on to store completed workflows?
Yeah, great question, Philip. Yes, we do support a content management system as well. So with FastFlow, we could either export any of the workflows to your hospital's existing content management system, or if you do not have a content management system or would like to keep the content management with FastFlow separate from your existing system, we also do offer a content management add-on that could be incorporated with the FastFlow purchase.
Okay. And the next question is, can I do group-based approval before the workflow moves to the next step?
Yes. So in the Visual Workflow Designer tool, when you're choosing the steps on the routing, whether or not you want to route it to a role or a department, to set up group-based approval, basically you would choose to route the particular workflow to an individual department. So for example, we could route it to accounting or IT. Within that workflow, you could link it to a particular step, and you could also set it up for group approval, where it requires a certain percentage of people to approve the workflow before it moves on to the next step. So for example, if you send it over to an IT group for group approval and you have 10 members in the IT group, you could set up the group approval to be 30%, where as soon as 3 of the 10 members approve the workflow, it will get routed on to the next step. If only 2 members approve the workflow, it will continue to sit in that approval state until the workflow is rejected or a third person approves it.
Okay. The next question, how many different workflows can I have in FastFlow?
The FastFlow software supports an unlimited number of workflows. There are a couple of different pricing models that are set up that you could talk to your sales reps about, depending on how many workflows you want to start off with. But we offer professional licensing and also enterprise licensing, which allow for unlimited workflows.
Okay. And the next question is, can I make separate approval groups outside of the Active Directory?
Yes. So within the Visual Workflow Designer tool, one of the steps, rather than passing by role or department, is also to pass based on a particular group or drop-down list of users that you create. So outside of your hospital's Active Directory system, you are able to build out separate group approval groups within FastFlow and add members into that particular group, and then prompt the member, prompt the initiator to choose someone from that group, or also set up group-based approval on who's ever assigned to those individual groups as well.
Okay, sounds good. Actually, I had 2 questions about mobility. Can you access FastFlow from your house? And kind of similar question, is it mobile?
So the way FastFlow is set up, it is a web-based application, and it is hosted within your hospital's environment. So basically, it's not out on the public internet. So in regards to accessing it from your house, you would have to have VPN access into your hospital's network to be able to reach the server located in your hospital. So if you do have VPN access on your laptop, you could be anywhere in the world technically and be able to connect into your hospital's network and then access FastFlow. In regards to the mobile device, it is a web-based application, so you are able to use an iPad or an iPhone or other handheld devices to access the application. But the same thing applies in regards to the VPN access. So since FastFlow is not sitting out on the public internet, you would first have to have your phone or handheld tablet device VPN back into your hospital's network before you're able to load the FastFlow webpage.
Okay. And next question, how do you convert a paper form into the purchase request form that you showed?
Okay, great question. So basically, in order to convert one of your existing forms into a FastFlow form, we would use our software called Form Designer. There's a couple different ways that we could do that conversion. If you have the form in electronic format already, such as a PDF or Word document, we install a virtual printer where you could simply just click, load up the form and click Print to Form Designer, and that will convert the form automatically. If you have the form on paper, as you stated, one option is to scan the paper document into the computer and save it as an image file or a PDF file, and then print that, if it's a PDF file, I should say, you could print that in the Form Designer to automatically load into our software. Once it is loaded in the form design software, it's the same form design software that's used with our FastPrint and our e-signature products. But once it is loaded in Form Designer, you're able to click on any of the text field, make changes, add the fillable fields, check boxes, etc.
Okay. Looks like I got one more question. Is this a standalone system only, or can it be interfaced with our very old HBOC materials management system?
So the way FastFlow works, it could be set up as a standalone system. Depending on, when you design the forms and add the forms into FastFlow, that is standalone. The SQL database that you're writing to is specific to FastFlow. However, we are able to query other databases. So if your materials management database, is SQL accessible, we would be able to set up FastFlow to be able to query that database to populate some of the forms with your materials management information. So it's designed to be run independent, and then the completed workflow would be sent out to content management, or you could view your data using SQL tools. but we are also able to interface with other databases. So it really depends on the specifics of that database. And for the person that asked this question, if you'd like to fill out a request for more information, we could talk to you individually about your materials management system and see what we could do there.
Sure. And just one last question come in, and then we'll move on. What other processors are hospitals automating in FastFlow in addition to purchase requisitions?
Yeah, so that's a very good question. So we're starting this series with a couple set workflows, such as the purchase request. Next month, we're going to be talking about automating HR processes. In December, IT access requests, and in January, clinical document solutions. So these series is just to really get you guys to think on, how else in the hospital that you could use FastFlow. There's many different uses where it could be used. For on the HR side, you could do time off requests, employee evaluations, status change requests, new hiring as well. On the IT side, you could do access requests for setting up new email accounts or changing permissions. For clinical documentation, for example, you could, if you're doing any type of documentation that's not supported by your HIS EMR currently, you could do that within FastFlow. So an example may be a sleep lab where there's not a section in your HIS system to enter that documentation and you're currently tracking it on paper or manually just typing it into the computer. You could build out a workflow to track that information and then automatically save it to content management and add it into the patient's electronic health record if you'd like as well.
Perfect. So we're going to wrap up questions now. At the end of the presentation, there's going to be a box for questions and suggestions on the landing page if you didn't get a chance to ask yours today, so look out for that. And as Ryan mentioned, we have several exciting webinars coming up for you. November 18th, we're going to be discussing automation of HR processes. December 16th, gearing up for the holidays, we're showing you how to automate your IT access requests. And then on January 13th, we'll be automating clinical document solutions. So if you're an IT professional, or purchasing manager, process improvement leader, operation leader, you should be at all these webinars and tell everyone who should be interested in these webinars to go ahead and register and get more informed on how we can help you, automate your processes. So like I said, the registration link for the series will be at the landing page at the close of the session, along with the opportunity to request a more personalized demo for that question I was asked earlier. You can do so there. And then also you have the opportunity to view the recent case studies and webinars that we've done. So that being said, I want to thank everyone for attending today, and we will see you next month.